As Inez just reported, platelet-rich plasma therapy, or blood spinning as it's sometimes known, is a common practice among professional athletes and weekend warriors who are recovering from surgery. Dr. Dr.Glashowem is an orthopedic surgeon. He's co-director of sports medicine at Mount Sinai Medical Center in New York. He's been at the forefront of American doctors who are offering this treatment. So what exactly, doctor, is platelet-rich plasma therapy?
Platelet-rich plasma, or sometimes called autologous conditioned plasma, which means taking your own blood and taking a fraction of that blood and putting it in the area where it's most needed. This is a concept that's been around for many years. It's become easier to do, and it's a simple office procedure where we would just draw your blood. We have a typical syringe like this, which in the case that I use, this ACP.
Hold it up just a little higher so we can see it afterward. Okay.
This is an ACP, or autologous conditioned plasma syringe, and it's such a compact device. We actually draw the blood out of the patient, and we pull back on the syringe, and we just take a little bit. 10 cc's is a very small amount. We put this device with the cap in a centrifuge, which just spins down and is a means of separating. We take the good parts out of the blood, and the bad parts we just discard. We then are able to take one syringe out of the other, and we generally get about 3 or 4 cc's of this platelet-rich plasma, or healing factors, or factors that enable the body to heal faster. We're not putting anything in the body. This is not doping. This is not outside drugs. This is actually just your own growth factors in the area where you need it.
How effective is it when treating joint conditions?
Well, you know, I've used it on a number of professional athletes, and oftentimes on the professional athletes that I operate on, golfers or football players, it's the buzz among the athletes as they want it, and their response is it makes a big difference. It's just not a one-off. It's several injections, 3 or 4 injections over a period of a week, and its preliminary data is actually very promising.
How much does it speed recovery?
Well, you know, there's several studies, and it depends what you're looking at. For instance, in certain knee injuries, and it's been shown to speed recovery 30 or 40%. A number of the Super Bowl athletes had this procedure done and anecdotally reported it's made a big difference on their ability to go back to the playing field more quickly. There's a lot of data that has to come out. There's a lot of science and a lot of clinical investigations going on right now. And over the next couple of years, I think we'll learn a lot more. But it's very different than doping. It's very different than HGH. It's not a drug.
Although we should point out that the World Anti-Doping Agency says it's okay to do this inside a joint space, but you can't inject this into muscles because the growth factors may actually enhance muscle growth.
Well, you know, I think there's some debate about that. It's certainly accepted in Major League Baseball. It's accepted in the NFL. And I've heard that WADA has come out and says you cannot give it intramuscularly.
Right.
And that's probably for the image of keeping it perfectly clean. But I don't think there's any legitimate data that shows that the IGF growth factor, which increases muscle mass, actually has any effect when injected into a muscle. But to be safe, one shouldn't. But most of the injuries we use it for are not into muscle anyway.
And one of the things that Inez mentioned was this active vegan, which apparently was found in the possession of the assistant of Dr. Glashowem. What exactly is that? How does it work? And why is it banned in this country?
Well, just to be clear, activagen and all these growth hormone factors have nothing to do with platelet-rich plasma or autologous conditioned plasma. It's apples and oranges. I'm not familiar with it because I don't use any of these drugs, but it's apparently a method by which one can stimulate one's red blood cells and sort of cheat to get the body to respond faster. It is a drug, unlike PRP or ACP, which is not a drug. Very different things.